Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Welcome, Mrs. Davis. It's good to see you today. How can I assist you?
Thank you, doctor. I've been having persistent pain and stiffness in my hands and knees, especially when I wake up in the morning. I'm concerned it might be arthritis.
I'm sorry to hear that. How long have you been experiencing these symptoms?
It started about 3 months ago, but the pain and stiffness have become more intense and frequent in the last few weeks.
Have you noticed any swelling or redness in the affected areas?
Yes, particularly in my fingers. Some mornings they're so swollen I struggle to make a fist.
Arthritis can manifest in various forms. Have you or anyone in your family had a history of arthritis or other autoimmune diseases?
My grandmother had rheumatoid arthritis, and I remember she used to complain about her hands and knees a lot.
Thank you for that information. Do you experience the pain and stiffness after periods of inactivity or even after some activities?
Mostly after inactivity, like when I get up in the morning. But I've also felt discomfort after gardening or carrying grocery bags.
How about your lifestyle and diet? Are you active, and do you follow any specific type of diet?
I try to walk every day, but lately the pain has been limiting me. Diet-wise, I eat a balanced meal, but have noticed that after consuming certain foods like red meat or sugary treats, the pain seems to worsen.
That's insightful. Some patients have noted that certain foods can exacerbate arthritis symptoms. Have you tried any over-the-counter pain relief or treatments?
I've been taking ibuprofen when it becomes unbearable, and it helps for a short time, but I don't want to rely on it.
Understandable. Chronic use of certain pain relievers can have side effects. Based on your description and family history, it could be a form of arthritis, possibly rheumatoid arthritis. But we'll need to conduct a physical exam and some tests to be sure.
That's what I was afraid of, but I'm glad I came in. I want to manage it and understand what's happening with my body.
It's always best to address these concerns early. Besides the tests, we'll discuss management strategies, therapies, and possibly medications that can help alleviate the symptoms and prevent progression.
I appreciate that, doctor. I want to be proactive about this and ensure I can still enjoy my daily activities without too much pain.
That's the spirit. Let's get started with the examination and move forward from there.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Dr. Carter, my family doctor told me that I have something called cirrhosis and referred me to you for more tests and management. I honestly don't know much about it.
Cirrhosis is a condition where there's scarring of the liver, often due to long-term continuous damage. I'm here to help you understand more about it and guide you through any necessary treatment or lifestyle changes. Can you start by telling me how you came to notice something was wrong?
Well, initially, I didn't think much of it. I noticed my skin and eyes looked a bit yellowish. Then, I started feeling very tired all the time, and my appetite decreased. I've lost quite a bit of weight too. My stomach seems swollen, and I feel a dull pain on my right side below my ribs.
I see. Jaundice, or the yellowish discoloration of the skin and eyes, is a common symptom of liver problems. Cirrhosis can lead to a buildup of fluids in the abdomen, which is likely causing your stomach swelling. How long have you been experiencing these symptoms?
I would say a few months now, but it's only in the last month or so that I felt it was getting worse.
Okay. And do you have any history of alcohol consumption or drug use?
I used to drink quite heavily in my younger days, almost daily for years. But I've cut back significantly in the past decade. I don't use any drugs.
Chronic alcohol consumption can be a major cause of liver damage leading to cirrhosis. It's good that you've cut back, but the damage from years of heavy drinking might have caught up. Have you ever been tested or treated for hepatitis?
No, I haven't. I didn't think I was at risk for that.
Hepatitis, especially types B and C, can lead to cirrhosis if not managed properly. We'll likely do some blood tests to rule that out as a contributing factor. Do you have a family history of liver disease?
Not that I know of, but then again, my family isn't very open about health issues.
All right, we might consider genetic testing down the road if necessary. It's crucial for us to understand the underlying cause so we can best manage the disease. We'll start with some blood tests to check your liver functions and exclude possibilities of hepatitis. Also an ultrasound to assess the liver and adjacent areas, and potentially a liver biopsy to assess the degree of scarring and damage.
That sounds like a lot. I'm worried. What can be done if it's confirmed that I have cirrhosis?
I understand your concerns. If diagnosed early, cirrhosis can be managed. We'll work on preventing further liver damage, treating the underlying cause, and managing your symptoms. This could include abstaining from alcohol, medication for any complications, and potentially discussing liver transplant if deemed necessary in the later stages.
Thank you, Dr. Carter. I appreciate the thoroughness. I'm ready to work on getting better.
That's the spirit. We'll tackle this together step by step. Your cooperation and understanding of the disease will play a significant role in managing it. Let's start with the tests and go from there.